Today, we begin a series of important events to mark a week whose significance is critical for the people of Kenya and essential to the government of Kenya. Our bottom-up economic transformation agenda stands on the foundation of creating sustainable capacities and viable opportunities for the empowerment of people at the bottom of the socioeconomic pyramid. A unique feature of the bottom-up agenda, therefore, is that each pillar of our economic transformation is deeply embedded in commitments arising from Article 43 of the Constitution, which sets our economic and social rights as fundamental human rights. Through our universal health coverage pillar, we are discharging our constitutional mandate to actualize every Kenyan's right to the highest attainable standard of health and to healthcare services. Similarly, the right to accessible and adequate housing, as well as reasonable standards of sanitation, are being realized through the affordable housing pillar of the plan for the bottom-up transformation. Additionally, our agro-industrial and food security pillar attends to the right of every Kenyan to be free from hunger and to have adequate food of acceptable standards. The right to clean, safe water is catered for through the irrigation and the water harvesting components of our agro-industry and food security, as well as the cross-cutting enablers of our plan. The right to social security, as already observed, forms the bedrock of the strategy and the foundation of our governing agenda. We are confident as a nation and as government that we can simultaneously pursue rapid economic transformation and social protection at the same time, and that ultimately we shall achieve both of them. Social protection cannot wait until 2030, when we will have achieved our economic vision. If it does, the development achieved at the expense of or in exclusion of social protection will be hollow and fragile. We must undertake both commitments simultaneously because the standard of social protection is a good measure of sustainability and the promise of shared prosperity. Cabinet has now approved that from June 1, the social protection cash transfer money will be disbursed before salaries of public servants is disbursed. I know for a very long time we've had social protection cash transfer money disbursed 3, 4, 5, 6, maybe sometimes 7 months after they are due. Treasury have undertaken that from June 1, before salaries of public servants is paid, cash transfer for the vulnerable will be paid. I think it is the moral thing to do, it is the right thing to do, because if we don't look after our vulnerable, we will be a society that will be judged very harshly. The reviewed National Social Protection Policy, therefore, provides a framework to coordinate interventions across the country that are being undertaken by a broad coalition of actors from various sectors. County governments, the private sector, multilateral organizations including UNICEF and the World Bank are among the government's cherished partners and collaborators in the social protection agenda. Consequently, the government established a dedicated Department of Social Protection and Citizen Affairs. The participation of multiple partners is highly welcome and appreciated due to the limited coverage of social protection interventions under such programs as social assistance, social security, and social health insurance, which face significant resource constraints. The government has allocated 28 billion to support cash transfer programs implemented by the State Department for Social Protection. Our journey towards universal health coverage is underway. Already, maternity services and primary health care are provided free of charge in our public hospitals. At the same time, people who earn low incomes, poor and vulnerable households, are receiving much-needed financial relief from the introduction of subsidized health insurance cover through the National Health Insurance Fund. 223,000 vulnerable households with bona fide NHIF membership have access to services including cancer care. Again, on this front, we are in discussion with stakeholders in that sector to actualize the commitment I made to the people of Kenya that we will make NHIF contributions affordable. At the moment, the lowest contributor pays 500 shillings. We have worked the numbers. It will be possible, beginning later this year, to pay 300 shillings and still keep the cover. Again, so that we can expand the number of people whom we can carry on board the National Health Insurance cover. We are having conversations with the county governments, and within the next few weeks, we will be rolling out the program that will also make it possible for us to now pay stipend to the 100,000 community health workers or volunteers across the country, again as a means to bring the people at the bottom of the pyramid on board health services. Malnutrition and undernutrition are severely punitive burdens for children. They also increase susceptibility to other diseases and the financial cost of treatment. In 2014, the cost of hunger survey estimated that costs associated with underweight children were 13.1 billion, while those associated with acute respiratory infections, acute diarrhea syndrome, fever, and malaria was approximately 800 million. To provide comprehensive protection for young children, the State Department of Health, Social Protection, Education, and Agriculture will strengthen their collaboration and coordination mechanisms to serve more vulnerable children and secure their present as well as their future. To make sure that all our children attend school, I did make a commitment, and we are in discussion with the counties, that all our schools, especially in our informal settlements, in our arid and semi-arid areas that have challenges to access to food, we have undertaken that every county government that provides school feeding program, we are going to match the funds as national government so that we can get more and more of our children to access food in school. I appreciate on this account the partnership of UNICEF and the World Bank with the government in the nutrition improvement for children through cash and health education program, economic inclusion. Inclusion, as well as the Universal Child Benefit Program, which is being piloted in Kisumu, Embu, and Kajiado counties. Beyond tackling malnutrition, these interventions also address exclusion by increasing the social protection cover of the vulnerable and supporting their economic empowerment to enhance resilience. Traditionally, the youth, women, and persons living with disability face tremendous obstacles in accessing opportunities to participate in development that they have been virtually excluded from meaningful economic activity. The financial vehicle to deliver this inclusion and ignite vigorous economic activity among vulnerable and marginalized Kenyans is the Hustler Fund. And a lot has been said about the Hustler Fund. This is a fund that is now about 4 months old. We have disbursed 23 billion shillings through that fund. We have 7 million Kenyans who borrow regularly on that fund. And because we introduced a savings component, already 1.35 billion shillings has been saved by people borrowing as less as between 500 and 1,000 shillings. Recently, we included, even for those who do not want to borrow any money, we included a component in the last 1 month for those who just want to save. And already in the last 1 month, 7 million shillings has been saved on that platform. And I am encouraged that there are many Kenyans who are prepared to walk with us the journey of saving so that we can also reduce vulnerability to people and give them a chance to access resources when times are difficult.